Hello, and thank you for joining me again today at the Invita Whiteboard. And we're continuing our conversation of understanding chronic disease, infectious disease, and autoimmune disease, how these three are related. And I want to go further is talk about how this disease can be triggered. So this video series is on how does this trigger? How's the disease triggered? So we talked about chronic disease, autoimmunity, okay, and infectious disease, and how can this be triggered? And this is to give us a little bit of an understanding. So here we have Bob, our wonderful patient that we've been using. And Bob has, let's say his whole life, he's had a series of infections in his body. He's had, for many years, he's had Lyme disease or Bartonella or Babesia or viruses like HHV6 and cytomegalovirus. I'm only using a few here to help illustrate my point. And these viruses have been in his body. But Bob has been very fortunate to have a good immune system over the years. In fact, he's had these infections since he's been a kid. And they've been sitting low grade in his body. Okay? And Bob has this little diagram I'm drawing around Bob that shows his strength of his immune system. Okay? And he's doing well. He's relatively healthy. And let me give you some scenarios. All of a sudden, a trigger comes along. And here's what the trigger is. The trigger, in his case, is Bob, at 25 years old, was climbing a ladder and he fell down and he had a trauma. And he had an accident. And during that trauma, his immune system became weakened. And now, this whole immune system piece is totally gone. It's weakened. He's become weakened. And these infections, toxins, heavy metals, like I was talking about before, have now created havoc in the body and they've increased. Did you see how the infection was already present, or the environment was already present in the body, of the toxicity or the heavy metals with the infections were present, but then the trauma released it? Now I'm going to list a group of triggers that might be present for people. Emotional traumas, like the deaths of people close to us. This can be a trauma, emotional trauma. Childbirth. Childbirth is a trauma. I mean, it's a beautiful thing that happens, but it's a trauma. The actual experience to the body can be a trauma. Another one can be dental or oral infections that have been persistent in the body for a very long time. Because if again, in our diagram, Bob, and I draw a tooth here, has had a chronic infection going on, and that's been building up because of a bad root canal that was done and it's sitting there, that begins to increase his toxic load and can be seen as a trauma. So we can have a physical trauma, an emotional trauma, a trauma that can occur. And you'll see this with women with childbirth, that all of a sudden they were fine. Then after childbirth, they're starting to be diagnosed with lupus, or they're starting to get their first diagnosis. And this is not uncommon that we see with autoimmune diseases or dental infection. And these are just a few of the traumas or triggers that can release the effects that are going on already inside the body. Does that make sense for you? So you're starting to see that we have this chronic autoimmunity and infectious disease, and it needs a trigger. And that trigger is a trauma. And it's very important that when you're understanding this disease, that you look and see, when did the trauma occur? Emotional, physical, even psychological, and like I said, even looking at things like latent infections. Okay? So thank you for joining me today at Invita's Whiteboard.